Welcome to the Turd Nerds. We are the functional gastroenterology podcast discussing all things poop. Before we take the plunge into today's episode, let us tell you a bit about ourselves. I'm Dr. Rebecca Sand, a naturopathic physician and acupuncturist, and I specialize in all things gastroenterology, hormones, and fertility.
I'm Dr. Ami Kapadia, and I'm a medical doctor trained in family medicine and functional medicine with a special interest in gastrointestinal health, food and environmental allergies, and autoimmune disease.
And I'm Dr. Ilana Gurevich, a naturopathic physician and acupuncturist who is board certified in naturopathic gastroenterology. I specialize in inflammatory bowel disease, IBS, and other functional digestive disorders. Let's jump into today's episode.
The following discussion is for educational purposes only and not intended to diagnose or treat any diseases or conditions. Please consult your doctor before incorporating any of this information into your care. The information presented on this podcast is not medical advice.
Okay, Turd Nerds, you stuck with us. You hung in there. We are finally on the treatment episode.
All right.
We've been hinting it. We've been dropping cues. It has arrived. Dr. Sand.
Treatment of
Insulin resistance, microbiome, perimenopause, menopause.
Yes.
I mean, we know some of the obvious things we can do for menopause and perimenopause. That isn't really what this is about, although we'll touch on it. It's like the junction with microbiome, insulin resistance, all of that. So foundational support. Do you want to start with menopause hormone therapy?
Yeah, let's just do
Sure.
a quick menopause hormone therapy 101.
Great.
When you're supplementing hormones for menopausal and perimenopausal women, you are supplementing progesterone, estrogen.
If they have a uterus, you have to do progesterone.
If they have a uterus, you have to do progesterone. The North American Menopause Society does not recommend using progesterone without a uterus. Sometimes I do find it helpful, even
For
with
sure.
women who don't have uteruses.
Yep, for sure.
And then for some women, depending on their blood labs, also testosterone.
Mhm.
And then sometimes there's a little subset of possibly also DHEA. Those are the hormones that we are supplementing.
Mhm.
For estrogen, the safest way to supplement estrogen is to do a topical patch. If you do a topical patch for
Yep.
supplementing estrogen, really
estradiol specifically.
estradiol specifically, you significantly avoid the risk of taking estrogen orally, which is blood clots.
Yep.
For progesterone, it is always an
But the risk of oral estradiol isn't as high as people think. A lot of people take it and it's totally safe. That's like another thing we have to kind of like get out of there. It's safe for a ton of people. It's just the risk is a little bit higher for cardiac events.
There seems to be no
with
real
oral.
reason to use it though outside of cost or intolerance to
Patches
topicals.
don't work for some
That's
people.
absolutely true.
And there might be more efficacy in the gut modulation piece with oral.
That would make sense.
Interesting.
Not 100%. We haven't like studied it, but if we put it in the gut, we get to help the lactobacillus.
So you have patients where the topical does not work and the oral
Yeah,
does?
for sure.
Like
Why do you
women
think?
who sauna a lot. Who are in the
Okay,
sauna
sure.
every day.
It's because there's a physical issue with absorption from the patch.
Women also,
And-
there are some women who react to the adhesive.
Right,
Yeah.
right.
So that's another issue.
That's an intolerance.
Yes.
Yep.
So it's not that it's not working, it's that they have
They
an
don't tolerate
intolerance to the patch.
I've also had to switch people to oral because it failed to manage their vasomotor symptoms.
Why do you think?
I think it has to do with how it's available via liver detoxification, transdermal
Okay.
versus oral.
Okay.
But I think it's part of the standard algorithm that if they're failing the patches to manage symptoms and it's safe
To do the oral.
you flip to oral.
Okay.
I will also say I don't have a lot of comfort dosing oral, so
Yeah.
I will generally refer to either.
always start patch.
I have a great nurse practitioner in my office
Yeah.
I'll refer to, or OB-GYNs. This
Yep.
is their specialty. So if they're stalling out of the primary care junction of
Yeah.
menopause management, I will punt over there. That's my comfort level.
And
Yeah.
usually you start with progesterone, right? For a while before you
I will
add.
always
Not
actually,
always.
I
Not always.
always front load progesterone. So progesterone, you need progesterone if they have a uterus.
Mhm.
Like estrogen is great for the brain. It's great for the vasculature. It's great for the whole body. It's not great for the uterus or the breast.
It grows things.
Gross things, right? So the way I dose is I will always front load oral micronized progesterone. That's the only progesterone that I am comfortable using in the perimenopausal and menopausal
As opposed
population.
to creams, vaginal.
No, as opposed to progestins,
oh, got it.
like medroxyprogestin.
Not even if they already have a Mirena or an IUD?
Mirena is different. So if that, we'll talk about that in a second.
Yep.
But I will use oral micronized progesterone, and I will generally front load it either a week or 2 weeks before I start the estradiol prescription, mainly to cover the uterus and see how they do.
Yeah.
They are going to have changes, as we talked about. There are hormonal receptors up and down the GI tract, up and down the brain, up and down the liver. So let me see what everything is doing. And so I will front load oral micronized progesterone at bedtime. It has a nice side effect of helping them sleep.
Yep.
And then I will start estradiol next. And then if I'm going to start testosterone, that is going to be a last thing. The other way you can dose hormones is orally in a troche or in a injection pellet, which is very, very wild, wild west and gray. I happen to be trained to do it, but I don't do it frequently, but it is an option for some women. And then you can also dose your progesterone in an IUD.
Progestin, yeah.
Progestin in an IUD that will cover the uterus, so that you don't have to change that. And so then you're just responding to the patch.
Yeah, and that's a great option for people because it will stop the bleeding for most folks. And you don't have to take a pill. So you're just looking at a patch and a device that, you've inserted.
So isn't there a school of thought in perimenopause where some women are just on progesterone for quite some time before, because their estrogen might be high that whole time? You don't necessarily want to add more estrogen at that time.
Yeah, what we talked about, I think, in the first episode of this series is, bringing that progesterone up to kind of mimic. And if you can, doing cyclical.
Yeah.
And the recommended dose is like 200 to 300 milligrams for 12 to 14 days, luteal phase dosing when your body would naturally be producing it. But some people are very, very sensitive. I have people, I'll compound it to 25 milligrams luteal phase.
Right.
To just see, because you can have weight gain, you can have bloating, you can have constipation, you can have all this stuff from progesterone. It slows things down. So, there's a huge dose range, but when you're talking about endometrial protection, because you added the estrogen, that's a whole other conversation.
I was just surprised that's not part of any of the algorithms. It's more like from integrative naturopathic teaching but it's like physiologically makes a lot more sense. So I'm not clear on why.
I don't think it's super well studied. So that's why
that could be.
And I think people worry about a risk of growing breast tissue and things like that with it.
Because of the progestin.
And no one messes with breast tissue growth because of cancer. So
I also will say that I do oftentimes have women who don't want to comply with a cyclical dosing. And so then I'll go lower dose all month long. And that's also not a bad option.
Yep.
And if you're not on estrogen, I would have some patients that would just get that progesterone cream and they felt it was helpful. I know it's not as efficacious, but I mean, you're not using it for you're not using it for endometrial protection. You're just using it in the perimenopausal period for symptoms.
Yeah,
absolutely.
And PMS.
And those are over the counter.
And histamine symptoms.
Yeah.
And it does a lot. And you can dose it cyclically or all the time. It's just not if you're trying to conceive, but
so awesome. If they're having like motility issues with the oral, maybe they just need the topical,
And they're not using some kind of device.
Yes.
So oral progesterone or progestins, we've got an implantable device. We've got an oral estradiol. We've got a patch.
Yep.
We've got a troche. We've got an oral testosterone. We have a topical
injection.
We can have a topical. We can have an injection. We can have a troche, but it's a little bit more gray. Or we can have a pellet. Also estradiol. We can have a pellet. There is no pellet for progesterone. Progesterone is either device or oral.
Yep. Or there's vaginal progesterone that is that we were taught was sufficiently protective of endometrial tissue. Progesterone, like a pharmaceutical version.
Suppository if you're on estradiol therapy.
Yeah, I feel like that was part of the. No,
I'm not using it.
Okay.
I'm not using that stock. Okay,
I use that for pregnant folks. Is like the only time I use vaginal progesterone. To like hold a pregnancy. Yeah. So the other things about menopausal hormone therapy, so MHT versus HRT, it's the more technical term, is that it does affect the microbiome. So systemic estrogen therapy, which could be oral or transdermal, restores lactobacillus population.
Crazy.
In both gut and vaginal microbiota. That is a study we have. That was a study in 2015 out of the Mayo Clinic. I am confused about that because I have so many people on menopause hormone therapy, systemic estrogen, who still need supplemental vaginal estrogen.
I would agree with that.
Oh yeah, I think that's part of I know it's like what you hear from the guidelines, and then what
you see in practice are very different.
Totally,
it seems like because you need local treatment as well for
sure.
GSM, right?
Yep.
Yeah, I do not think that a topical estrogen is going to get to the vagina.
It doesn't.
And unfortunately,
sometimes, but it is not the norm.
It's not. Yeah, you can't bank on it.
Yeah, it seems like usually you need both, even though I don't think that's how the guidelines show. So,
no. But yeah, clinically, I guess we're all in You got to put some, and vulvar and vaginal are different. Sometimes people need both. So
yeah, I mean, the vagina loves estrogen.
I know.
And when you lose it, it gets
lactobacillus.
friable. Yes.
Yep. And that's why we lose that tissue plumpness.
Yes.
And the urethral tone and all of that.
Juiciness. I like to say juiciness.
Yeah, that is one.
Prevention of UTIs, right?
Definitely prevention of UTIs.
Thing.
And as we age, also prevention of sepsis.
Yeah.
Because the UTI, as we're in our 8th, 9th, 10th decade, we can get.
So many women get recurrent UTIs, and it seems like it should be standard of care to just put everyone
standard of care.
That, because now even if we've had patients that are in a nursing home or other places, there's no one to apply it, but there's now actual insert.
Yeah.
So you could just use that. I feel like that should just be like something we check off for everyone.
This is what I'm going to say. It will definitively be standard of care in about 15 years.
Yeah.
I guarantee you. There's no way it won't, because the data is so robust. Also, anecdotally, that's just what we all see.
What is the risks coverage for the non-cream version? Like the actual insert?
This is what I'm going to say.
Okay.
It is so cheap.
But it would be cheaper than.
We have so many cheap options.
Yeah. And you know what's expensive? Sepsis.
Right. I'm just wondering, like, commercially, for patients who can't apply because of they're disabled or whatever it is, they're often the ones getting recurrent UTIs. Yeah. So I just don't know the cost of ordering the insert.
I also don't.
Yeah, great option. Yeah, I mean we're a little behind in women's health.
Yeah, I'm like, what are we? Why is this just a checkbox? Of all the checkboxes I have, why is this not a checkbox?
I'm with you. I'm so with you.
That's a good point.
Yeah. So, as we talked about, transdermal estrogen has more favorable metabolic profile, than oral, less hepatic burden compared to oral forms. And, I think it'd be an interesting study to see which one has a better effect on the gut. Yeah. Because I would imagine oral estrogen does. I mean, that's not a reason to give it. That's not like we can't make our decisions based on that. It's like safety and all of that. But, it restores, according to the study, lactobacillus populations.
That's amazing.
That's phenomenal.
And I will definitely say that when I put an intravaginal application, I would believe that, because a lot of their female vulvovaginal symptoms just get better.
Yeah, I know. It's wild.
Yeah.
And we see that postpartum for folks too, because your estrogen is through the roof at the end of pregnancy. Yeah. And then completely bottoms out. Yep. And part of now more and more OBs are just prescribing vaginal estrogen postpartum for a similar reason. It's a lot like menopause for a bit of time, where you bottom out, and adding that vaginal estrogen helps with healing.
Yeah. For sure.
It's wild.
For sure.
Yeah. So, okay, that's kind of the basics of hormone therapy. We covered a lot of what progesterone does in terms of insulin resistance in part 2 of this series. So adding progesterone has tons of benefits too for GABA and digestion and appetite control and all of that. But should we go on to diet? Should we go on to herbs? Should we go on to...
Let's do herbs next.
We've talked a lot about diet. So maybe a very quick diet recap.
Okay.
Because we talked on insulin resistance.
Yeah. Okay. So diet specifics. Anybody want to guess?
High protein, high fiber.
Yep. So fiber supports those short chain fatty acid bugs.
Yes.
And detoxification of excess estrogen.
And enhances insulin sensitivity. So again, shout out to my favorites.
Yeah.
Reading my mind here. I'm impressed. Yeah.
We know you well. We've been doing this a while.
Yeah. What I'll have people do is, if they're going to eat something in that perimenopausal window, that they're out with their friends having pizza, bring your psyllium, put it in your bag, have some psyllium caps with it. Just do it for me. Start your meal.
Okay.
With
so
the
I have a question on psyllium. So we tell people, otherwise, I know different than what you're just describing, take it away from meals, but then it's in certain food.
People take it with food.
Oh, okay. I have to take it with food.
Just get it in.
You just have them take it with any meal? That would be increased compliance. Or whenever, just take it.
You just can't take it with other pills.
Right. But it doesn't really, I don't think it doesn't really affect nutritional absorption, right?
I mean, it's a food. It's a fiber, it's a food.
That's why I
like it. That's why I like it.
So that will help
it
compliance.
Easier. Yes, for sure.
Phenols.
I love polyphenols. They're the things that make blueberries blue and raspberries red and cherries purple.
And a lot of things delicious.
Yeah.
Yeah.
That's true.
So polyphenols are great for cognition. We know that. They promote microbial diversity, reduce oxidative stress. They're potent antioxidants. So berries, green tea, olive oil, they're easy things to just incorporate in your day. Just be mindful of that.
Chocolate.
Yeah, chocolate, big time. Nuts.
Whatever 85% dark chocolate you're eating, that has
So you're killing it on that front.
Yeah.
Great work. Great work. Phytoestrogens. People love to tackle or take this one apart. So soy, also like every herb on the planet except Vitex. A lot of people think it's Vitex, but it's not. These are metabolized by the microbiome into estrogen-like compounds. that we think, although everyone debates this, mildly bind to our estrogen receptors, blocking stronger binding during the perimenopausal period that causes more issues. Good. Yes, totally. You got to be careful with it in some conditions, but yeah, you are.
Unsweetened soy milk.
Organic, please.
Yes,
organic.
it's in a green and white box.
We have ruined that plant in the United States conventionally. Yes. And then, so those are like the big ones. And then what we want to avoid is like the obvious stuff that's going to worsen everything. So ultra processed foods, sugar and alcohol, killer for the microbiome. Like we don't need to talk about
and that. Estrogen effects of alcohol.
Yeah.
Big time.
And histamine.
Which is why it's probably a risk for breast cancer.
Yeah.
One of the
also
reasons.
Sleep effects of alcohol.
Yeah.
I mean, who has time to give up their sleep?
Apparently a lot of people.
And during COVID, even
I just can't. Yeah. Man, I am worthless.
Me too.
Listen to our sleep episode. Yeah, that's depressing. Okay, so
so that was diet.
Yeah. Now let's talk about, I don't know, digestion in general.
We don't care about that though.
Yeah, we fixed it. Fix underlying causes of the microbiome. Mm-hmm. That's obvious. Like if you're perimenopausal, menopausal folks come in, you think they have SIBO, don't miss that.
Yes.
Refer them to someone who can treat it or anything. Yeah. Any microbiome imbalance, like treat an underlying cause. Then basic stuff to kind of support. So we've got bitters, we've got bile support. We're going to talk more about that in a future episode. Probiotics.
Okay, wait. So bitters, we're talking dandelion, we're talking artichoke, we're talking
gentian.
Oh, I love gentian.
I love gentian too.
Scutellaria. That's my favorite. Gentian scutellaria. We are talking, if you want an easy hack on this, there's a lot of bitter products.
Sprays.
There's like a bitter spray. You can also just go to the liquor store and get bitters from the liquor store.
Totally.
That are very cheap that you make a bitter
water
cocktail with.
Like make water
or mocktail.
Or spritzer. Right?
Put it in, make a spritzer.
Yeah,
it's delicious.
Put it in soda water and it's awesome.
That just primes the digestive process, primes the digestive juices. So then as you start, you can digest appropriately and improve the microbiome.
Yep. Yeah. That's awesome.
Bitters.
Yeah, vagal nerve tone. It's great for everything, mood, all sorts of stuff. So some specifics on other things. Magnesium.
Oh, everybody loves magnesium.
We love magnesium. Yeah, fixes a lot of things. Yeah. So I give this is like standard for my perimenopausal folks. Magnesium glycinate, because glycine also helps in the perimenopausal window.
Blood sugar.
Oh my God, glycine is like the amino acid for perimenopausal state.
And taurine too?
Taurine as well.
Yes, and they work together.
So I'll have people do it after dinner. To kind of optimize that. Magnesium glycinate.
After dinner, not at bedtime.
You can do it before bedtime, but like sometimes in that window. Uniquely, magnesium helps sensitize estrogen receptors. So also in menopause, to kind of just help get that sensitization going as long as we can to keep natural estrogen circulating. It reduces insulin resistance, helps mitochondria, and helps GABA synthesis. Magnesium does all that.
Magnesium glycinate or just magnesium? Okay.
I just prefer the glycinate form in the perimenopausal population.
Unless they're constipated.
That makes sense.
Well, then I'll give both.
Okay.
There's magnesium supplements that have glycinate and other citramine.
Yeah, like triple magnesium combos. Yeah. So B6 we know can help upregulate diamine oxidase in the gut. So histamine breakdown for folks. We like that. We use it for a lot of neuropsych conditions. B6 is a cofactor in our neurotransmitter synthesis. It also helps with estrogen detoxification while enhancing progesterone production. So B6 will help. A lot of what we do in perimenopause, a lot of what I do in perimenopause is help the ovaries like do the best they can with those remaining ovulations. And B6 is one of the ways we can do it because that's how we get progesterone is through ovulation. So things like Vitex, which we'll get to in a minute, B6 are like mainstays in perimenopause to just kind of help keep as much progesterone as we can in the body. Anti-inflammatories.
Yes, turmeric, ginger, boswellia.
Yep.
I mean, a billion.
Resveratrol is one of my favorites for hormones and for the gut. Yep. Any of those are great. And, as we talked about in the second episode, low-grade inflammation is a huge driver of insulin resistance and inflammation. So don't forget, especially if you do see in your patient's labs that CRP start to creep up, from whatever their baseline was. If it's just starting to like inch up, don't underestimate those for people. And they have a huge effect on the gut, So maybe that's how they work is just by gut modulation. I don't know. Berberine.
Yep. Oh, berberine. Dr. Kapadia
was for insulin resistance because I thought of metformin and I was like, we should just use berberine.
Yep.
So berberine does have an action that is very similar, virtually identical to metformin's action, where it's working for insulin resistance to sensitize towards the insulin state.
Yep.
It also is really good for the microbiome, for dysbiosis,
inflammation.
It's anti-inflammatory.
It has GLP-1 activity.
It also has a lower lipid lowering activity.
So I always learn not to use like the Coptis form long term because it's very strong. But I think there's milder berberine forms. There's so many different varieties.
And so berberine is an active constituent. Like, it's a little bit crazy. Berberine is an active constituent in a lot of plants. Those plants are generally bitter. Those plants involve Coptis, Oregon grape, which is Mahonia. Echinacea has a berberine compound.
So I feel like maybe Oregon grape is less cold. Like
Oregon grape is definitely less cold than Coptis.
And it's not endangered, which is good too.
Okay.
It grows like a weed.
So that might be a better source. So
can I tell you guys a quick Oregon grape story? When me and my husband were first dating, I was in naturopathic school, right? And we were walking and falling in love, and it was very romantic. It was summer, which is in Oregon, in Portland. It's like there's no better place to do, right? There's no better place to do summer. And we're walking, and we walked by this plant. I'm like, oh, it's Oregon grape, and he didn't think. He heard grape. He took a berry off and he ate it.
It was oregano.
It was Oregon grape,
right?
And then he spit it right out.
Yeah,
and he was like, "What the hell are you doing?" And I was like, "I never said eat it. It's the most bitter plant on the planet, but that is, I identified for you." You will never forget Oregon grape.
You're welcome.
Yes.
Yeah. Romantic.
Very. I aim to please.
Okay. So we got berberine. It does just about everything in this population.
Yes.
Something I wanted to ask the two of you is, keeping people on berberine.
I don't.
I don't recommend.
So if it is what is managing lipids, or if it is what's managing insulin resistance for people, or even blood pressure, or things like that, how do you manage that?
Generally, I am a big fan of rotating through.
Great.
Yeah.
Same. So, on and off.
1 to 3 months. And then let's find something out. We can use bergamot. We have other things that do similar things. We can use other bitters.
Ramp up on, like, have them do a Whole30 for our break, or, I
or
think
even fasting mimicking.
Yeah. Totally. Tons of options. Rotating.
And so that's my preference. Also for chronic bacterial changes or chronic dysbiosis, I also don't want the microbiome to get used to anything.
That's right. Yeah. That's my big worry is like berberine has major effects on the microbiome. And if we do it just always long term.
That being said, I feel less concerned about using whole plants than I do about berberine constituents.
Yeah. One of my big populations that I think about this a lot is PCOS, because the insulin resistance is a main driver of PCOS in a lot of folks, and they benefit a lot from berberine. But I don't want to keep them on it.
Yeah.
So that I do think a good rule of thumb with herbal medicine for a lot of folks is pulsing. And this is no exception for all those reasons.
I agree.
So we talked in our last episode about the intestinal permeability, the LPS, endotoxemia, all of that. So knowing that, what are some supplements for leaky gut that we would want to bring on board?
Glutamine, SBIs or colostrum. Ginger is a good anti-inflammatory.
Zinc carnosine,
erythritol.
Any of the gut healing herbs. We have whole episodes on this. And then I would also put in here avoiding excessive elimination diets.
Interesting. Tell us
during
why.
this phase, because we're already looking at that decrease in alpha diversity for folks. And if we start restricting things, we're just going to like enhance that.
Yeah.
So I don't want people on restrictive diets if I can help it at all. But a lot of people notice they start losing or gaining weight. So then they want to start restricting, and then they notice that their bloating also gets better. So they start restricting, and we teach women to do this anyway. And that's not okay. Like, we have to eat diverse things. Our gut likes diverse things. If you can do diverse fermented things, do that.
If you tolerate them.
If you tolerate them. But that's another thing that we need to really be thinking about. I think we all do. We want people eating and enjoying food. We enjoy and eat food.
And let's just bring up that really important study that was put out in like the last 5 years.
Yeah.
That looked at, you're trying to get 32 different plant matter things in your diet a week.
Yep.
And so that's like oregano and basil and tomatoes.
Yeah. In your spaghetti sauce.
And so if you can get 30 something,
Yep.
I mean, I feel like when I was into it, I was counting, I was getting like 30 in a day because I cook with a lot of herbs and spices.
Yeah. And if you have a salad, if you have a soup with veggies in it.
Salads, when it's like right out of the garden, it's like crunchy and crispy.
And it's like hot and humid out. Yeah.
Nothing better. This is what's nice about living in the Pacific Northwest.
No, it just like falls into your mouth.
Yeah.
It's amazing. Yeah.
In the middle of summer.
Yep. Okay. So as we're kind of getting into other supplements here, melatonin.
Oh, you mentioned that. You dropped that last episode.
I really love melatonin for sleep. It's great for that. We know that, but it's a super antioxidant.
It's one of the best anti-inflammatories we have.
Yeah. So back to our last episode on inflammaging and immunosenescence and all of that. Like, we lose melatonin as we age, or we just stop producing it as much as we age. And that starts in our 30s.
Yep.
The decline starts in our 30s. So like,
as
Consider melatonin. It's a potent antioxidant for the gut, and it's a potent antioxidant for ovaries. So as we're thinking about enhancing like our remaining chances of ovulation, think about that. I use it in fertility, as I've mentioned a lot.
It's got great data in fertility.
Yep. So, I mean, and sleep. Like, if we don't sleep, we're going to crave carbs. Guaranteed.
Oh my God. That is so damn true. I wish it wasn't.
I know.
Well, I don't have
you don't know about this. I guess what I should be saying is, Rebecca.
I know. That is why I allow a sleep opportunity of like 14 hours, because I'm a wreck without it. But you have to prioritize sleep. Also, if you're going to ovulate, most of us ovulate at night.
Oh.
If you're skimping on sleep, you're reducing your chances of ovulating. Oh. The like catch 22 here though is with that drop in progesterone, people don't sleep well. So we can't, like, on our end as people's providers, we can't forget to get people sleeping.
Right.
Don't underestimate
melatonin and or maybe progesterone.
Yeah, for sure. And glycine and all the other things that can help you sleep. Magnesium, exactly. So sleep regulates our ghrelin, which is our hunger hormone.
It sure does.
It promotes ovulation. It does everything. Don't underestimate that. Whatever helps to sleep, melatonin's great. Other ovulation supports on that front, we've got NAC, zinc.
Oh, I love NAC.
Vitex. Yeah, and NAC does everything, right?
Yeah, NAC does everything.
N-acetylcysteine.
Feed the glutathione pathway, which is going to help you detox all the garbage you're exposed to in this world.
Yep. So beta-glucuronidase, like, think about that. Zinc has hormonal effects, big time hormonal effects. So we use it for that and ovulation. Vitex and inositol. Really great one for insulin resistance. And we use it strictly for ovulation enhancement as well.
Is there a glycine component to the microbiome? Does glycine in particular, because it definitely helps with the insulin resistance.
Yeah.
It definitely helps with the perimenopausal state.
Yeah.
It definitely helps with, I think it, like, for me at least, it pushes like the GABAergic. It's one of the best things for sleep.
Yes.
And insomnia in the perimenopausal state. Do we know if it does anything for the microbiome?
I don't know off the top of my head, but that's a great question. Okay. I have to say yes, but I don't know.
Okay, interesting.
Watch it be like completely gut mediated.
I mean, that would make sense to me. It is also very, very sweet.
Yeah.
And so I was making, for a while, I'll do it a lot in like colder months. I'll make myself a nighttime sleepy time tea that has a lot of the GABAergic herbs, plus glycine and inositol, but it's very sweet.
Yeah, I know. Yeah, it helps.
Sounds good.
It helps.
It actually is really good.
Yeah. Wasn't Karina putting it in the chai?
No, that's inulin.
Oh, okay.
She uses inulin.
She made really good chai.
It was really
good. And as sugars go, like, if your main source of sugar is glycine and inulin,
you're okay.
We're fine here.
But inulin is amazing. It's also sweet, but it's a prebiotic.
Yep.
It's great. I love it. It's in my, I'm like not skipping on my inulin at all.
Yep. Okay. Calcium D-glucarate.
Oh, my favorite.
I've been waiting to bring this one up. I know.
There is nothing better for my body than calcium D-glucarate for my PMS state.
I mean, PMS, perimenopause, endometriosis.
Like, you just take it when you get symptoms?
Yes. So how I instruct my patients to take it is I say you can take it in one of two ways. You can take 500 milligrams every day. And then when you get irritable, you can up it to 1500 milligrams once or twice a day. Or you can get irritable, look at your app, and take 1500 milligrams once to twice a day, which is what I do. I'm pilled out.
Yeah. And I use it daily for folks with estrogen driven conditions, adenomyosis, endometriosis, things like that. Sense. And you're just on 1500
every day.
It's expensive.
It's not that expensive.
Well, it's gotten cheaper. In like the last year and a half, it's gotten cheaper, which is great. But 3 pills a day every day.
Yeah, totally.
That one is, but for endo, it's wonderful because we get that. So it works. Calcium D-glucarate works with our beta-glucuronidase. It decreases beta-glucuronidase activity in the gut. And that is the whole, like, listen to the first episode of this. We go into all of that. But calcium D-glucarate is one of the few things that just like directly acts on that. You hear the word calcium in it, but it's only 9% calcium. You just need the calcium to kind of stabilize it. This isn't really systemically absorbed. It's kind of working in that, microbiome, liver, detoxification of predominantly estrogens.
Empty stomach, or does it matter?
I just have people get it in. I haven't noticed a difference.
I take it at bedtime on an empty stomach. I have no nausea, no side effects from it.
Yeah, it's super well tolerated.
Yeah.
It's not messing up your hormones. A lot of people think it like messes with your hormones.
It just helps detox.
It doesn't mess with your production or binding or use. It's the recirculation that your body meant to have this estrogen leave the body. It's just your gut microbiome
is not letting it
messes it up.
So it's not really going to mess someone up, even if they don't have excess estrogen. There would just be no reason to take it. But
I will also say I have women where it's so effective for the PMDD, they can get off their antidepressants, right? That happens. I have women who literally set their calendar to, okay, this is usually my ovulatory period. I'm just going to start taking it. And they are like, I used to have 2 different people who lived in my house, the first half of the month person and the second half of the month person.
I know.
And now I have one person who lives in my house thanks to calcium D-glucarate.
I know.
It is the closest thing to hormonal magic that I have for some bodies, not for everybody.
I'd say about 80% of people notice breast tenderness that happens with PMS or perimenopause, because that can be like really painful for people. It takes care of that. Yep. It's wonderful.
It's wonderful.
The mood and sleep stuff.
I mean, the thing is, in perimenopause, it's hard to know if your mood symptoms would be from estrogen excess or low progesterone or both. So you might need both.
You might need both.
Yeah.
Yeah.
Why not?
Yeah. Why not?
Why not do both? Yeah. So prebiotics and postbiotics.
Yes.
Especially, yes.
Yes.
That's the turd nerd stamp.
Ideally from food, right?
Prebiotics are food. Inulin, chicory, fiber, Jerusalem artichokes, sunchokes, they all provide really good prebiotics.
Yeah. Yep.
Bitters.
Bifidobacterium species probiotics specifically may modulate beta-glucuronidase activity too. By displacing the overgrowth of proteobacteria and Clostridia. So those
just take up space.
Yeah. They displace it. So in supplementing with it, we do have a little bit of data. You know, we know that taking probiotics doesn't colonize the gut, but if you're actively taking them, you might be able to displace some of those ones that, you know, we mentioned in episode 1 here, those specific strains of bacteria that cause an increase in beta-glucuronidase activity. So, I mean, that was cool to me. Okay. Other herbs. Ooh. So we got phytoprogesterones, phytoestrogens.
Okay.
I really like them all.
Can you list them?
Yeah.
I don't really know.
So phytoestrogen, it's plant-based estrogen binding constituents. They're weaker. They're not going to act like estrogen in the body. They bind more weakly to these receptors, and they bind to sometimes different receptors in different parts of the body, but they act like estrogens in the body. And these people tear these apart. We go through phases of loving them and hating them. Yeah. Newsflash, they're in literally everything. They're in everything. Every herb out there is basically a phytoestrogen except Vitex. Okay. People think that
Which is a phytoprogesterone?
It's a phytoprogesterone. Vitex works with our estrogens by acting on the brain. So think about it for like PCOS.
Vitex is taste tree. It is the herb of the hormonal period of your life.
Yeah, it works on our brain. It's just one of the only things, if like in PCOS, for example, when the cascade disruption happens from the brain level, that, you know, the GnRH pulsing and all of that with the LH and FSH getting off, Vitex works on that. Also in perimenopause, when our ovulation is our brain and our ovaries are learning to communicate differently. If we're trying to kind of ovulate a little bit more, Vitex can help with that. So, but it's a phytoprogesterone. So phytoestrogens, we've got fenugreek.
Makes breast milk also.
Makes breast milk and helps with blood sugar regulation.
Yep.
So that's a win-win. Chinese peony.
What is that called in Chinese?
Shishao.
Oh.
Baishao.
Oh, yeah, of course.
Yep.
Okay.
Wild yam.
Yeah.
We all know that one. Vitex. We talked about that. And then phytoestrogens. We've got hops, flax, soy, red clover are like the big ones.
Yeah.
But there are a lot of them out there. Other herbs, adrenal adaptogens.
Oh, God.
Why would that make sense?
Yeah. Because of the cortisol.
Yep. Yeah. So we do see cortisol rise in perimenopause because of all of the things.
Does maca fall into an adrenal adaptogen?
Yeah.
Or that's an adrenal?
It does a lot of things.
Does it also have hormonal effect?
Is it a phyto one of those?
I want to say phytoprogesterone.
Okay.
But I don't remember off the top of my head. But that I see help tremendously with libido, energy levels. Yeah, it's great.
There's no such thing as a phytotestosterone.
That's a great question.
I mean, no, there definitely is. Shilajit.
Oh, yeah. There's
horny goat weed.
Horny goat weed.
Yep. Zinc works pretty well.
Selenium also.
But
those are not.
Ashwagandha. Yeah. I mean, there are tons of options for that, for enhancing testosterone.
Shilajit is having a moment right now.
Oh, yeah.
Yeah.
I mean, I think they all have been on the internet for a while, but yeah. Okay, and then I want to do a shout out for Chinese herbs in this population in supporting and nourishing the yin, which, you know, we talked about. And for those of us who practice Chinese medicine, they'll know what that means. There's a big shift in our bodies in Chinese medicine during this time, and those herbs can be magic. Disgusting.
One of my girlfriends does not tolerate hormones at all. She cannot. They make her crazy. And her Kaiser GP was like, you need to see an acupuncturist, honey.
Amazing.
You need to see a Chinese herbalist.
Yeah, that's amazing. That's good stuff. Yeah. Okay, so those are some herbs. I want to talk a little bit about movement.
So nothing can replace movement.
Yeah.
At all.
I know. It underpins everything. I want to talk about why here. So it helps digestion, it helps the microbiome. And I just, like, if you're not moving, move. That's it. And if you can find something you like to do that. And we'll give you some specifics here. Exercise enhances microbial diversity, particularly akkermansia. So that's a cool one. Know. How many of these tests have we run where akkermansia
is non-detectable,
below the detectable limit in our population? Yeah. So that's a hot tip. And that species is linked to a lot of metabolic health things. That's been coming out for a while. Exercise reduces inflammation. We know that. That's especially important in perimenopause. Strength training, which
bone
we
density,
talked about.
Sarcopenia.
Exactly. Insulin sensitivity, bone density, muscle mass. Those all get worse with perimenopause, and especially when we lose our estrogen. Exercise modulates our cortisol, and exercise enhances our estrogen receptor expression.
So, wow, that's crazy.
Right.
Huh? Okay.
So it turns out it's good for you.
Yeah. I mean, I think I say it 1,000 times. If we had a drug that could do what exercise could do, everybody would take it because it is that effective. And yet everybody doesn't take it. They sit on their desks and become a, human pile of human
potato.
Yeah.
Yeah. A human pile of human. I love that. That's how I feel some days.
Yeah, I know.
Yeah.
Me too.
And then monitoring, I just want to put a shout out there for, what we're doing for these folks. Lab tests for monitoring. I would put that in like part of treatment.
For the insulin, for the testosterone.
HOMA-IR if you can get it. Triglycerides will often start to speak during this time. That goes right along with that visceral accumulation.
Looking at the lipid panel and adding an ApoB.
Yeah.
Making sure that they're not genetically predisposed with an LP(a).
Yeah, and we've talked about this many times on the podcast, but glucose monitoring, continuous glucose monitoring can be
I love
one
CGM.
of
Direct to consumer now.
Yeah, that was really pretty affordable.
Just buy it.
Yeah, it's come a long way. And if you're looking to make changes in your health and routines, like that is one of the best ways because in real time you get to learn about your body.
Yes.
So that I use a lot in this population. A1C, of course. There are some basics here we always check. And then consider, if you're worried about these things, a liver ultrasound.
Yeah.
For people to just be checking on fatty liver infiltration.
Yeah, because when you look at the stats of NASH, non-alcoholic, what's the name?
It's metabolic.
Oh, metabolic, that's what it is.
Yeah. MAFLD or something like that.
Yeah. It's insane.
Yeah.
The difference in the last 30 years. It's frightening.
I know. So that insulin, triglyceride, glucose change in perimenopause, I catch it all the time.
Yeah.
And those are things that we don't really look at, or I think conventionally maybe we normalize triglycerides being a little higher.
Yeah.
Or we just assume they weren't fasting or something like that. But those are early markers you can kind of detect in this perimenopausal transition and in PCOS for folks. So have that on your radar and do something about it. Berberine is a great option for a lot of that. So
that was a really good, and I think
so many options.
Yep. The perimenopausal state is really just a hugely changing state with a lot of moving
very dynamic.
Pieces.
Yep.
You need to be looking at it through this umbrella lens, but if you can give the inputs correctly, they can change how they're feeling.
Yeah.
And we can have women feel better in their 40s and 50s than they did in their 20s and 30s.
Yeah. And I really just want to emphasize, you don't need to restrict your food to not gain weight.
Change how
this is what we teach women is that you're getting fat, you're in your 40s. What do you expect? Oh, you're also tired. Try exercising more. People in their 40s start to exercise because they're miserable, and it doesn't always work. There's so much more we can do to help people, and you don't need to just eat nothing throughout the day. That will worsen your symptoms.
Okay, so treatment overview: medications, HRT, herbal options for phytoestrogen, phytoprogesterone.
Yep.
Dietary changes with increasing protein, eating more fiber for detox.
Prebiotics,
working
postbiotics.
on estrogen detox if you're in that state where it's higher. What else?
That was, I think,
nutrients, exercise, sleep.
Yeah, melatonin, sleep, nutrients, especially
support your adrenal glands. Fix your microbiome.
And move.
Yeah,
sounds like another course waiting to happen.
That's right.
Because we have so much time.
Oh, we're here.
Happy menopausing, turds.
Happy menopausing. We've got you. Bye.
Thanks for joining us today. Stay tuned. We release episodes every 2 weeks.
If you like this episode, please subscribe and don't forget to rate and review us to help spread the turd nerd word.